Hey everyone, it's Mary Ann from the New York City Organization of Public Service Retirees. So today I want to talk to you about Mayor Adams' press conference, which was November 12th. So let's just listen and then I'll add my commentary to set the record straight, since no one else seems to be telling him the truth.
Chanel, go ahead.
Hi, Mr. Mayor.
How are you?
Good. The council recently introduced a bill to enshrine protections in the city.
I'm sorry.
The council recently introduced a bill to enshrine protections in the city's administrative code to ensure city retirees' healthcare plans are kept the same and are not diminished by a switch off to plans such as Medicare Advantage. If it passes, would you sign the bill into law?
I don't know if I'm just not picking. I can't hear you. No?
I'm telling you to be a little loud.
Yeah.
This council recently introduced a bill to enshrine protections in the city's administrative code to ensure city retirees' healthcare plans are kept the same and are not diminished by a switch off to plans such as Medicare Advantage. If it passes, would you sign the bill into law? Would you support a bill like that?
One of the things I inherited that was just really problematic, and we need to find a solution to, is that the health care plan for our retirees. And so we're going to look at this bill. I know it was introduced previously. We're going to look at it. We have to find an answer. We have a real problem with our health care benefits. The cost of health care, how it is impacting retirees and employees. I have a meeting coming up with the MLC, the union heads, to try to address this issue. It's a real problem, and I inherited it, and we're going to find a solution to it. And you can't just merely say, let's just legislate our way out of it. You got to really find the funds without passing on the cost of these health care issues to workers and our retirees. And, we have had several meetings, Jock Jihad, also Renee Campion, the union leaders. Everyone is trying to put their heads together and try to figure out how we can solve this problem. It's a real issue. And we'll look over the legislation.
So there's a few things in there that I find disturbing. We have called, New York City Organization of Public Service Retirees has called to speak with the mayor multiple times on this. I even emailed Ingrid a couple of weeks ago, and she's insisting she can't speak with me because our organization is in the middle of suing the city. And I said, I'm not looking to discuss litigation with you. This would strictly be about healthcare, which those are conversations we could have. I don't have to talk to you about the litigation. I don't even want to talk to you about litigation. And I've never wanted to talk to her about litigation. She would not be the person, nor the mayor, to discuss the law. They're not lawyers. But I can discuss healthcare. I can discuss other issues with them. And they have refused to meet on that. And I do believe Renee Campion, the Commissioner of Labor Relations, does not want the mayor to sit with us because she doesn't want him to know the truth. Or it would have been called a long time ago, a meeting for us to sit at the table with him and her, asking her, as Ingrid wanted over a year ago, to ask me a question in front of Commissioner Campion and allow her to answer it in front of me. And Renee blocked that meeting. They don't want the truth to come out. And so they keep pushing the retirees off. So the mayor said first that there was a high cost of health care that was affecting employees and retirees. The cost of health care is not to a Medicare eligible retiree. As we've said from the very beginning, for example, we can show you with rate sheets going back to 1997, the city health care plan that pays for the 20% of a medical bill that Medicare doesn't pay. So Medicare pays the first 80%. The city supplement for a Medicare eligible retiree pays the last 20%. That plan in 1997 was $88. Today, it's about $200. That is not skyrocketing. It only pays 20%. What is skyrocketing is that the mayor's office forced retirees to start paying copays of $15 on every single service, every single test, everything, starting in January, which we stopped when the copay case was started that we filed. However, think about this for a second. The city currently charges a $15 copay on many services that an active worker pays, but the city healthcare plan pays for 100% of that bill. So to ask an employee who's making six figures at this point in many cases, to pay $15 a visit or a service that the city is covering in 100%, that's one thing. But when you're asking a retiree who's on Medicare to pay that same $15, and the city is only paying through their supplement 20% of coverage, you're basically telling them to pay 75% of that cost. Because at the time when Emblem started to charge us copays in 2022, there were times when we were paying the bulk of the bill and Emblem was paying nothing. Emblem never even paid anything in some of those costs. So you're asking a retiree on Medicare, your more vulnerable population, to pay a larger percentage of the cost of healthcare than you are an active worker. And that's wrong. So to say that skyrocketing costs or healthcare costs or you know what it is, and he should face the fact. It's not just that costs are expensive because they are. An active worker, the cost if for a single person is about $1,000 a month, $2,500 or $2,700 family. Medicare eligible is $200. We are not skyrocketing and we are not costing the city more money. The fact of the matter is, and I have to say this again bluntly, the Mayor's Office of Labor Relations had two largest unions in the city, the UFT and DC 37, leverage all of the unions in the cities, retirees and current retirees, future retirees and current retirees, their health care for their contracts. They literally funded their contracts by forcing people into privatized Medicare Advantage following the Project 2025 blueprint. And I kid you not, labor should never have privatized a federal public health benefit. You have unions like 32BJ going to Washington to protect healthcare inequity, to protect Medicaid. And yet these unions wanted to privatize Medicare. One of the greatest civil rights achievements in history, allowing everyone to see any doctor or hospital, regardless of color or income. And yet, putting us into Medicare Advantage would have taken those wins away. We should not be doing that. And it is a federal public health benefit. And I tell Michael Mulgrew all the time, what is it that you are against privatizing public education, but you're okay with privatizing public health? And he still thinks they're different. They're not. It's just one affects him more than the other. The mayor also said he's meeting with the MLC and the union heads. Retirees are not in unions, Mayor Adams. The union leaders don't represent us, and the MLC doesn't represent us. We were not at the table. We were not in the room. Therefore, we were on the menu. It has always been the city council to protect retirees, current retirees, through legislation. Healthcare in the city of New York was born in legislation, 1967 under Mayor Lindsay, and two city councilmen, Mario Marola and Edmund Farrell. They legislated 12-126. Every change to retiree healthcare has been done by legislation, and the legislation is 12-126, which states the city will pay the full cost of health coverage for every employee, retiree, and their dependent up to the HIP HMO, which was the city's plan at the time, on a category basis of individual and family. The city will pay. And that is because when this program was founded, and we have all the history on this, there was to be a choice of healthcare plans for employees and retirees. This is what was founded because the mayor wanted his employees to be healthy to come to work. He wanted their families to be healthy so that the worker didn't have to take off to take care of them. This was futuristic. The city will pay. We have memos that the then mayor had to ask the governor for permission to do this on the city level. And now, under Bob Lynn and Renee Campion and Claire Levitt, they're dismantling the history of retiree health benefits and allowed the two largest unions to leverage healthcare citywide to fund their contracts on the backs of everybody. And that is an improper practice. That is bad faith bargaining and negotiating. And under the MLC, where every union has one vote for every 250 members, still in line with the original bylaws from 1966, the two largest unions can pass a 2/3 motion without the other 100 behind them. And they screwed everybody. The mayor also said that we just can't legislate our way out of passing costs. Well, you've been passing costs on to retirees forever. You've been passing costs on to employees forever. This is what the Mayor's Office of Labor Relations has been doing for the last 20 years. You need to stop diminishing your health care for raises. The mayor should set a precedent that we should not be diminishing health benefits to fund contracts, and that should come from him. And Mayor Adams, if you truly do want an education, you need to sit with me. As representative for the New York City retirees, we've been fighting for 3.5 years to preserve our health benefits. We don't need to discuss litigation. You and I need to discuss how these plan changes and what the MLC under the auspice of your Office of Labor Relations has been doing to the healthcare program in the city of New York. And why? You mentioned a couple weeks ago that the Health Stabilization Fund has no money. It's because previous mayors have allowed that money to be used in wrongful ways. Call me. Our website is nycretirees.org. Our email is retirees@nycretirees.org, www.nycretirees.org. We look forward to hearing from anyone that wants to talk about this issue and not sweep it under the rug. The Speaker's office has blocked our bill. She threatens city council members from getting onto our legislation. Civil Service and Labor Chair Carmen De La Rosa refused last year to bring our bill to a hearing. It was always the city council that protected current retirees because they are not represented by any union under state and city law. Invite us in the room. You deserve to hear the truth. We look forward to hearing from you, Mayor Adams.